Since we are at the top of the hour, I think we can go ahead and get started. Um, let's see, Serena, would you mind to put us to the second slide, please? Just want to start off with a quick reminder for folks who are joining. If you need a certificate for CE or CM points, please plan to, within 2 weeks of today's webinar, submit an online evaluation and be sure to provide your full name in that evaluation. And email ncoshirk@unc.edu to request a certificate. These instructions will be sent out in an email to all registrants as alongside a recording, but just wanted to make sure you all are aware of that. Welcome, everybody. We are really excited to have you join us for this webinar that's Carolina Center and NC OSHIRK co-hosting the Osteoarthritis Action Alliance with us today. For today's webinar, can you please ask your questions via the Q&A function? We'll store all questions until the Q&A session at the end of today's webinar. During that time, you can also raise your hand using the little raise hand function at the bottom of your screen to request to be unmuted. And we are recording today's session, and we are going to share the recording on our websites and with registrants so that folks can watch this afterwards. That is fine. Yeah, we can go ahead and I want to do a brief introduction. I know we have some people who are joining us who are not familiar with the Carolina Center and with NC OSHIRK. So by way of introduction, my name is Maya Leff. I'm the Associate Director for the Carolina Center for Healthy Work Design and Worker Wellbeing. Our mission is to generate new knowledge and improve worker health, safety, and well-being in North Carolina, the Southeast region, and the nation. And we have a special focus on essential workers and the impact of working conditions on health outcomes. Today's webinar is co-hosted by the North Carolina Occupational Safety and Health Education and Research Center. And NC OSHIRK's mission is to provide high-quality education and research training in occupational health and safety sciences to protect and promote worker health. A little bit more about our two centers, if you would advance, please. Thank you. The Carolina Center is one of 10 NIOSH-funded centers of excellence in total worker health. If you're joining us from out of state, you can see you may have a center near you that you would like to become familiar with and work with. The Total Worker Health Centers have a mission to conduct research to advance worker well-being. At our center, we have two large research projects. One led by Dr. Lucas Mazur that is investigating how healthcare work environments, issues like manager support, work scheduling flexibility, workload, impact nurse and physician, burnout, depression, PTSD, and moral distress coming out of the COVID-19 pandemic. We also have a large research project focused on firefighter slips, trips, and falls. Dr. Eric Ryan and his team have recruited over 900 firefighters at this point to participate in this prospective study that's looking at how working conditions, firefighter characteristics, and health and safety behaviors impact their risk of slips, trips, and falls. At the center, we also have a pilot project program, which gives small grants to investigators who are interested in starting a new project in total worker health. And we also have our outreach and education core, which is co-sponsoring today's webinar. Next slide, please. The North Carolina Occupational Safety and Health Education and Research Center is one of 18 NIOSH-funded education and research centers. Like the Total Worker Health Centers, all ERCs have active research projects in the occupational safety and health field, but they are also responsible for training our nation's workforce in occupational safety and health. Here at UNC, we have a program for occupational medicine physicians, for exposure science and industrial hygiene, for occupational epidemiology, for ergonomics and human factors engineering, and we also have a certificate in total worker health. Next slide, please. So before we get into today's topic, we also want to share with you all an opportunity to take action to support worker health and safety. All of the work that I just shared with you, our two centers and all the centers across the US, cannot happen without federal support through the National Institute for Occupational Safety and Health. We're extensions of NIOSH's mission to research hazards in US workplaces, come up with solutions to mitigate those hazards, and train the workforce to address them. So we have a way for you to help. Here's how you can help. First, for folks who have been involved with our two centers, we really encourage you at this time to share your story, contact your legislators, and tell them how the Carolina Center and NC OSHRC have made a positive difference in your work and ask them to protect NIOSH-funded research centers. We also encourage you to reach out to your legislators and encourage them to reinstate funding for the National Institute for Occupational Safety and Health. Many of you are probably aware that NIOSH has been cut by over 90%. If you would advance, please. Thank you. To the next slide. Thank you. Just a few resources to take action in this. We encourage you to coordinate with your professional association. I know we have many OCMed physicians on the call today, as well as occupational health nurses. Both ACOM and AOHN have materials that you can use to contact your legislators. We also have great materials coming out of the American Industrial Hygiene Association, American Society of Safety Professionals, and the Society for Total Worker Health. If you don't see your association, we encourage you to work with them to craft a letter. And with that, I would like to introduce our speakers. Very excited to have this group with us here today. So we have three speakers. We have Katie Huffman. Katie is the Director of Education and Outreach for the Osteoarthritis Action Alliance and Research Project Manager in the UNC School of Medicine's Thurston Arthritis Research Center. Katie has a master's degree in gerontology with experience in social work, health and wellness coaching, and research. For Osteoarthritis Action Alliance, Katie coordinates the development of educational resources for her patients, healthcare providers, and employers on topics related to osteoarthritis. We also have Serena Wiesner. Serena is the Director of Community Programs for the Alliance. She's a gerontologist dedicated to helping communities and organizations support health and wellness through evidence-based programs and services. She has held roles in national, state, and regional organizations and has overseen numerous public and private grants, providing essential health programming to thousands of people across the country. As someone who has lived with joint pain and also observed its impact on loved ones, Serena is determined to bring actionable resources and solutions to those with OA. And finally, Nadia Maza. Nadia is an experienced public health professional with over a decade of experience. As the project director and principal investigator of the CDC's State Arthritis and Wellbeing Program in North Carolina, she leads initiatives to expand evidence-based community health programs and improve healthcare provider referral and reimbursement pathways. Welcome, everyone. Thank you. I'm going to hand it over to our speakers.
Wonderful. Thanks so much, Maya. And thank you to all of you for being here today. I really appreciate you taking some time out of your day to learn about joint pain and how important it is to tackle joint pain in the workplace. As you can see, here is a beautiful picture of UNC Chapel Hill, which is where we are located, along with our friends at the Carolina Center. And the OA Action Alliance, just briefly, is a national public health coalition that is really focused on elevating osteoarthritis as a public health priority. We do this through a number of resources and education and collaboration, not just throughout North Carolina, but throughout the whole country. So Katie, a little bit later in the presentation, is going to highlight just a brief snippet of some of the resources that we have available, just kind of an example of some of the things that we do at the OA Action Alliance. So many of you here today, because you are interested in workplace health and employee health, may be wondering why we want to talk about osteoarthritis. Isn't osteoarthritis just something that impacts older adults? Is this really something that we need to think about for our working age population? So I'd like to just introduce you to Maria really quickly. So Maria is in her mid-30s. She is a wife and a mother to a very active 5-year-old boy. And she's also a nurse in a labor and delivery department at a local hospital. So as with most nurses, she works 3 12-hour shifts each week. And she's spending a lot of time on her feet and performing repetitive motions like bending and lifting and stooping and walking up and down stairs within the hospital. So Maria loves her job. She has been doing this for over a decade. She loves her patients. She loves her coworkers. But her recent list of health challenges is growing a little bit longer and making it difficult to truly enjoy her job. She has high blood pressure, she's pre-diabetic, she has a BMI of 30, and of course, she has some joint pain in her knees, hips, and lower back. So not only do these things make her job as a nurse difficult, but it also makes tasks that she has to do every day difficult, like walking up and down stairs or carrying laundry. And then, of course, the things that she really loves, like playing at the park with her son. So these are all becoming more and more challenging. Maria is not alone. 32.5 million adults in the US have osteoarthritis, which is the most common form of arthritis, and joint pain is the most common symptom for these people. Many people, as I mentioned, think of osteoarthritis as an old person's disease, but the truth is that it impacts people of all ages, and the impact is significant. Over 50% of those with OA are of working age. So we just described that as from approximate ages of 18 to 64. So if you think about maybe the employee who struggles to climb the stairs to a meeting, or the warehouse worker who can't lift heavy boxes without wincing every time they do, or perhaps the customer service representative who is constantly shifting in her chair, just trying to find a comfortable position. Or maybe it's a person like Maria who goes home after her long 12-hour shifts and immediately ices her knees. So for all of these people, the pain isn't just a nuisance. It's not just a bother that they have to deal with, but it's a true barrier to living to their full potential. Joint pain is also a real pain for employers too. Individuals with joint pain reported significantly greater impairment of work productivity, with presenteeism rather than absenteeism being the major contributor to the loss of work productivity. One study actually reported that 79% of study participants with knee OA reported some decrease in productivity, and 42% reported significant loss of their ability to fully function in their usual roles at work. These are numbers we just simply cannot ignore. And that's why I'm so happy that so many of you are here today to learn more about this. Employers and employees, excuse me, should know that osteoarthritis is the most common cause of disability. And this disability is primarily the result of pain and stiffness that occurs in one or more joints. Almost 50% of people with arthritis say they experience pain every single day. Most people, like Maria, seek treatment when the pain in their joints has significantly impacted their lives. And that impact may be because of pain, and it may be because of lost wages, because they aren't able to pick up all the shifts that they need, or have to take short-term disability. So by the time Maria sought treatment, she was already on the path to a future knee replacement. So what causes osteoarthritis? Why is Maria, an active woman, suffering joint pain at such a young age? This slide shows just some of the common causes of joint pain and osteoarthritis. So as you can see, some of these, like being overweight, are modifiable so that's something that we can do something about. While others, like perhaps a genetic defect, are non-modifiable. So that really urges us to take action on those things that we can change and we can do something about. It's also important for the employers and the occupational health people in the room to note that repetitive motions, like those with certain jobs, like Maria's, can cause excessive and prolonged stress on joints. And that excessive and prolonged stress on the joints can actually accelerate cartilage breakdown and lead to osteoarthritis. So this is not to say that osteoarthritis is what is commonly referred to as the wear and tear disease. Not all people who are quote unquote tough on their joints will develop osteoarthritis, and those who have osteoarthritis may experience more than just a loss of the protective cartilage in the joints. Osteoarthritis itself is actually a very complex condition involving the entire joint. So that includes the bone, the cartilage, the ligaments, the tissues lining the joint. And inflammation is kind of playing that significant role in contributing to stiffness and pain in the joints. People with OA are also likely to have other ongoing health challenges as well. So, like Maria, who has high blood pressure and is pre-diabetic, over 50% of those with osteoarthritis have at least one other chronic condition, and 30% have 5 or more chronic conditions. Diabetes, heart disease, sleep disorders, and depression all have strong correlations with osteoarthritis. So, why would that be? Well, you can think about joint pain as one of the driving factors in a vicious cycle that makes good health hard to obtain. So, as Maria's joint pain increased, not only did she not want to exercise like her doctor recommended that she do to help manage her high blood pressure and help her lose a little bit of weight, but she also thought that the exercise would actually hurt her joints more and cause her more pain. And this is a common myth for those with joint pain due to osteoarthritis. In fact, like treatment for diabetes and for cardiovascular disease and many of the other kind of high ticket chronic conditions, physical activity is actually the primary strategy for addressing the disease. So Maria's lack of physical activity outside of the workplace actually contributed to creeping weight gain, which ended up causing more pressure on her joints, which ended up causing more pain. So this is all, as you can see, a vicious cycle that we must find some place to kind of break that cycle. And studies have actually found that for every 10 pounds a person gains, that's an increased force of about 40 pounds on their knee joints. So although there is no cure for osteoarthritis, we can work to prevent it and manage symptoms. There are 4 strategies that are highlighted in the National Public Health Agenda for osteoarthritis: weight management, self-management education, injury prevention, and of course, physical activity. I do want to mention that there are other non-pharmacological treatments, such as bracing, as well as pharmacological treatments like taking NSAIDs, but I will not be addressing those today. If you would like to learn more about those, please feel free to scan this QR code. And you can learn more about some of those other strategies. But for this presentation, I'm going to focus on these 4 areas. The ultimate goal, too, for all 4 of these is to decrease pain and improve function. And so that includes function at the workplace. So first and foremost, weight management. We've already briefly touched on the power of weight management for knee pain. So 10% decrease in weight can equal a 50% decrease in pain, and that is significant. But also small amounts of weight loss can help patients achieve improved pain and function, and particularly in the knee and hip. For Maria, this might mean more enjoyable and pain-free walks with her dog here. This is regular physical activity is essential for maintaining joint health, reducing pain, and improving function. Something as simple as walking the dog will contribute to lubricating and strengthening joints. Activities that are low impact, that don't cause increased pain for more than 2 hours after exercise, those are kind of just right. Those are the ones we're looking to engage in. With any physical activity, it's important to, warm up, start slow, start where you are, not jump right in and do, a 5K training or anything like that, but just start slow and start where you are. And then create a routine that's doable and enjoyable. And of course, listen to your body. So if someone who has joint pain engages in physical activity and then ends up experiencing more pain the day after they exercise, that doesn't mean that they shouldn't exercise. That doesn't mean that they shouldn't be physically active. It just means that they need to dial it back a little bit and start a little bit slower the next time. A lot of people do with joint pain feel like, oh, my knee hurts more today after I went for a bike ride. That means I shouldn't go for a bike ride. And we want to kind of prevent that train of thought. Injury prevention. So preventing injuries can actually help avoid osteoarthritis in later life, particularly injuries to the knee. So this is very common when we think about people with a history of a knee injury, like an ACL tear. Those people maybe who were youth athletes or had a mishap on the ski slopes one year, those people are 3 to 6 times more likely than those without a knee injury to develop osteoarthritis in their knees. So something to be thinking about now as a preventive measure to osteoarthritis. And of course, repetitive motions with and injuries to joints, like some of the things that can happen in the workplace, can actually cause OA in the future, especially if they're not managed and treated early. And then self-management. So this includes strategies and skills for managing all of the pieces of the chronic disease puzzle. So that can include managing medications, managing pain, managing your communication with your healthcare providers. So those are all self-management tools that people like Maria really need to master. They need to strengthen those skills in order to improve their joint symptoms. And so these can be learned and reinforced through workshops that focus on decreasing the pain, fatigue, and depression that sometimes goes along with osteoarthritis, as well as other chronic conditions. So I'm going to go ahead and turn it over to my colleague, Katie. She's going to talk about some of the things that people like Maria can take advantage of, some tools that we have created at the OAAA Action Alliance for people like Maria and for her employer.
Thank you, Serena. Yeah, so I'm just going to begin with a few quick tips for what employers can do to support employees like Maria on their journey with joint pain, and then we will go through a few of them. We have QR codes throughout, so you can scan those to get directly to these resources. First, it's important for employers to recognize the impact that joint pain like Maria's has on their workforce and its ripple effect on other, perhaps more obviously burdensome conditions like diabetes and heart disease. If employees with heart disease don't want to exercise because of their joint pain, like Serena was describing in that vicious cycle, it's going to be hard to manage their heart disease and prevent a heart attack. Second, knowledge is power. Employees need to understand their condition and learn strategies to manage their pain. Employers can provide information and education to help their employees, like Maria, learn more about their joint pain and ways to control their symptoms. Third, employers can provide access to evidence-based programs like the Arthritis Foundation's Walk with Ease that have been shown to positively impact joint pain and other osteoarthritis symptoms. So just to give you a little more insight into the resources the OA Action Alliance has developed to help employers and employees manage their joint pain in the workplace, I'm going to highlight a few of them now. First, for employers, these are 3 example resources that describe much of what Serena went over earlier. Some of the healthcare costs, presenteeism and absenteeism rates, safety issues that are important for employers to consider. And these materials are important to be shared with leadership, with HR, wellness departments, even insurers to help make the case for addressing arthritis. The infographic on the left provides a general overview of osteoarthritis, includes a lot of the statistics that Serena shared, the impact on employees, comorbidities, and employers' bottom line. The video on the right highlights some of the more financial related costs of OA to employers and employees. And in the middle, we have some information for employers about the recommended treatment options for osteoarthritis, and we provide examples of how employers can address arthritis through their benefits plans, their policies, their wellness programs, and their safety initiatives. Next slide. We have many resources for adults like Maria. There's a video that describes how joint pain and other symptoms can impact their work tasks and daily activities, and it includes some tips for managing osteoarthritis on the job. And then we have a postcard that goes along with the video that describes the signs and symptoms and has a few more kind of hands-on tips for managing osteoarthritis at work. And the idea with this set was that the video could be played in a workplace lobby or a lunchroom, and the postcard could be posted nearby for employees to take with them. Next slide. Here on the left, we have a poster that could be also hung in a common area, a break room, that informs employees about osteoarthritis and how it can be managed. In the middle, we have an infographic that describes strategies that help adults with their joint pain on the job, and specifically speaks to employees in different positions, whether they're mostly seated throughout the day, they're standing and walking, or they're doing heavy labor, and some specific strategies for each of those lifestyles. And finally, on the right is a handout with information on the front explaining how to get started with a joint-friendly physical activity plan. And on the back is a worksheet with some goal setting. There are many other resources for individuals on our website that deal with managing joint pain. And then finally, I just want to mention Walk with Ease, and as an evidence-based arthritis management program, there are over 20 programs available to help Maria manage her arthritis. Generally, these programs are called arthritis appropriate evidence-based interventions, and they may already be available in your community, offered through senior centers, YMCAs, or health departments. National organizations offer them, and they're available in a variety of formats, whether that's self-directed, online, in person with an instructor, even over the telephone and through the mail. The Arthritis Foundation's Walk with Ease is just one example of those programs, and it would actually be a great option for Maria. It is a 6-week walking and behavior change program that is delivered using the guidebook shown here. It's either delivered by an instructor or as a self-study. It's available in English and Spanish, and it has been proven to increase physical activity, reduce arthritis symptoms, and improve overall health. The Osteoarthritis Action Alliance operates an online delivery system to help organizations such as employers or healthcare clinics administer the Walk with Ease program. This system automates book delivery, sends out engagement and motivational messages and helps participants track their walking, while also providing a robust data collection and reporting features for the employer or other delivering organization. But like I said, this is just one example of an arthritis management program that can be tailored for employers and employees. And we hope you'll explore the website to learn about all of the available arthritis appropriate evidence-based interventions. Now I'm going to turn it over to Nadia, who will describe how her organization used Walk with Ease as part of a state employee wellness initiative.
Yeah, thanks, Katie, and thank you, Serena, and everyone for being here. As Maya mentioned, I'm Nadia Maza, and I oversee a cooperative agreement with the CDC's Arthritis and Wellbeing Program. And our work really focuses on implementing arthritis-appropriate evidence-based interventions that have been evaluated specifically to support adults suffering from arthritis. And this work is part of North Carolina's Healthy Aging in C initiative. It's a part of the North Carolina Center for Health and Wellness, and we are housed at the University of North Carolina in Asheville, as you can see from my mountainous background here. So yeah, like Katie mentioned, I'm excited to share this example of the work we've done in partnership with the Osteoarthritis Action Alliance, as well as the Office of State Human Resources to promote Walk with Ease, which is one of those arthritis-appropriate evidence-based interventions supported by the CDC in our state. So our strategy with this was to build upon an existing popular walking program that the Office of State Human Resources was already having success with and enrolling a lot of participants in. And so that challenge was called Miles for Wellness, and it's a virtual statewide team-based walking initiative that's offered by and for state employees of North Carolina. So the purpose of Miles for Wellness is to encourage and support employees to increase their level of physical activity, and they explicitly state the goal of folks achieving 10,000 steps or about 5 miles most days of the week, which we thought some folks might be intimidated by that goal and need some support in building up to it. So we started offering Walk with Ease as a warm-up to this Miles for Wellness program. And we did this by training Walk with Ease leaders, such as myself, at the Healthy Aging in C initiative to lead the program. And then we would promote, or we have been since 2020, we've been promoting registration using flyers like the one you see on this slide here, just as an example. So this flyer was shared to all state employees, and they received it from the Office of State Human Resources leading up to Miles for Wellness, encouraging those who maybe needed some additional support to join in on that initiative to sign up for Walk with Ease as a warm-up to it. So when people register for the program, they also have the opportunity to opt in to additional layers of support. So like Katie mentioned, this program can either be offered in person, completely self-directed, or a hybrid model almost called self-directed enhanced. And so that's what we were offering to state employees by including these additional supports and starting and ending the program together. So folks might be walking on their own, but we were engaging them in other ways. So one of them was weekly emails, both from the Osteoarthritis Action Alliance as well as from us. Participants also have the option to join a Facebook group where all participants can communicate with each other and communicate with us as trained leaders. And each week we'll post some type of prompt to encourage folks to engage with us, engage with each other, ask questions, solve problems, and really go through the program together, even though we're participating from all over the state. So in 2021, we adopted the Osteoarthritis Action Alliance's registration portal that Katie shared. So we adopted that delivery system because it really streamlined registration, and it allowed us to manage our participants more effectively. And that was great because we began to be able to track how many folks we were enrolling and how they were doing. And we were able to enroll an average of over 400 participants per year for these last several years since 2021. So this has been a great option for folks in our state to gradually and safely build a walking routine in preparation for this popular statewide worksite walking initiative, Miles for Wellness. And with that, I'll pass it back to you, Serena.
Great. Thanks so much, Nadia. And thank you to Nadia for being an early adopter of the Walk With Ease online delivery system. This was something that we kind of just threw out into the universe in 2019 before the pandemic hit. And she was an early adopter and just ran with it. And as you can see from her success here, that it's really helped and been an attractive resource to employees for the state of North Carolina. So I did want to put our contact information up. I hope that you'll reach out to us if you have any additional questions. If the Walk With Ease online delivery system is something that you're interested in learning more about, I'm happy to do a demo with you and see if it might fit into an employee wellness program that you have crafted. But ultimately, we want all of you here today to know that joint pain doesn't have to be a barrier to productivity in the workplace. Or a barrier to overall wellness and happiness and well-being. By addressing weight management, injury prevention, self-management, education, and physical activity, we can create a healthier and more productive workforce. So Maria knows that there's got to be a way to manage her joint pain and continue doing the job that she loves. And while also enjoying time with her young family. And it's my hope that her employer, who might be here on this webinar right now, can learn some of the resources and share them with her and her coworkers to help her learn more about managing her joint pain and some of the things that she can do. I think together, if we all work toward kind of changing the stigma surrounding joint pain, we can create a culture of support and empowerment that doesn't just impact osteoarthritis, but also impacts diabetes and heart disease and other chronic conditions that can have a significant impact on our workplace. So I will go ahead now and pass it back to Maya and see if she wants to open it up for any questions, or if we want to just address them through the chat and the Q&A.
Yeah, we can go ahead and open for questions. Yeah, folks can put their questions in the Q&A. We can see them and answer them, or you can raise your hand and we can unmute you. And we do have a couple of questions just about the recording and the slides, and we will be sharing the recording and slides in an email to everyone who registered for this webinar. So you will have access to these materials. But yeah, opening up for the Q&A, what questions would folks like to ask our panelists? All right, and you all may be able to see this. We have one in the chat. How do you keep employees motivated to walk year round?
Yeah, I can take a first stab and then I can pass it to Nadia. She probably has some good info too. So one of the things that we've used through our online delivery system for Walk With Ease is just ongoing text messaging and email messages that help people just kind of keep walking and keep physical activity at the front of mind. I think a lot of the programs that we promote as arthritis appropriate evidence-based interventions include a component of behavior change because there are going to be times when you don't feel like walking, and there are going to be times when it's raining outside or it's, 120 degrees like it feels like here in the summer sometimes. And so part of that is helping people anticipate the barriers that they are going to run up against throughout the year, and coming up with some solutions to those barriers that they can then put into action when they come up to that. So those are just some ideas of what we have learned and what we've done. Nadia, do you have anything to add?
Yeah, I definitely echo everything you said, Serena. I think helping folks problem solve and plan ahead is a big piece of it. Something else I've seen work really well with our partners across the state who are delivering the Walk with Ease program specifically, not just to their employees, but maybe to their community members and otherwise. Something that seems to work really well is when folks make friends in the Walk with Ease group. So even if it's offered virtually, if folks find each other and start walking together, or even just developing like an accountability system, I've noticed a lot of walking groups and walking initiatives form and extend beyond the length of a walking program just by way of relationship. So I think by encouraging participants to communicate with each other, or whatever initiative you're implementing, if it can be community oriented in any way, I think those relationships are huge for sustaining physical activity beyond the length of the program. That being said, I think the structure of the program really helps people be accountable and show up regularly enough over time to allow those relationships to build and form.
Mhm. Mhm. Yeah. And I think as with any type of program, there's going to be ebbs and flows. I mean, life happens. You have to be ready for maybe a month of intense caregiving duties. So you aren't going to be able to walk like you used to. And so learning to pivot, like we've all done over the past several years, you learn to pivot and you get back on your schedule and you show yourself some grace and just kind of start over. So a lot of people will just kind of fall off the walking wagon and then not get back on. But I think that as long as we can just understand that this is not a linear process at all, that if we don't walk for a week, that's okay. We just start back the next week, and that's okay. Just with regard to the online delivery system, we do have automated messages that will note if somebody hasn't walked or hasn't recorded their walking or hasn't set a goal, and it'll remind them, oh, hey, we noticed you have not walked or you have not set a goal. Just a reminder to do that. So I see let's see, some other questions. Resources that can be used for evidence that work caused substantial aggravation of osteoarthritis. I'm not quite sure. Could I get some more? Okay, Katie's looks like she's responding to that one. Do you have any data that shows the impact of your program in reducing workplace injuries? We do. There is a study on Walk with Ease and how it has impacted employees. And so I will share that with Maya so that she can share it with all of you when she sends out the information. Let's see, anything else? And I do want to just reiterate that Walk with Ease is not the only program that works well in kind of an employee-employer dynamic. It's just one of the kind of what we call low-hanging fruit. It's inexpensive. It can be offered as a self-directed option. It's really great for people who are inactive right now and are just kind of just trying to figure out how to get started with something. So, definitely explore the other arthritis appropriate evidence-based interventions on our website for more.
Katie, would you like to add anything to the two questions that you answered in the chat?
Just related to the question about some other strategies besides Walk with Ease that employers can use to create a work environment that's helpful for addressing arthritis. I did put a resource in the chat. We use the NIOSH framework, the hierarchy of controls, to try to put that into an employer perspective where there are different approaches you can take, whether it's eliminating excessive or repetitive motions or substituting heavy lifting with like electronic lifts, redesigning workspaces, like doing ergonomics assessments. Obviously, education is key, helping people understand if they have the condition and letting them know what resources are available. And then looking at ways your benefits plans can cover whether it's medications or even wellness benefits that can help people with arthritis, whether it's weight loss, nutrition, counseling. There are a variety of different ways, and a lot of it is just, even if you're already offering those, is educating employees about how they would be beneficial if they do have arthritis, or even letting them know that those benefits exist. And then the other question was about evidence for work that contributes to osteoarthritis. And a lot of that research is based on military or construction, farming, some of those very heavy labor focused occupations, but hopefully that systematic review will have a little bit of insight for you.
Thank you, Katie. Oh, we have another question coming in. Let's see. In the chat here, and I think, how do you approach patients who do physical work and have advanced DJD in their spine? They can't continue heavy work, which accelerates the damage.
Yeah, I mean, and I'll say we always preface this by saying we're not clinicians. It's the kind of thing that might be best addressed with occupational health or with a clinician. A lot of our resources are geared more for knee and hip osteoarthritis, to be perfectly honest. That's where a lot of the research is. A lot of the interventions are geared more toward knee and hip osteoarthritis. And more for people who are kind of in the early to middle time frame of their disease, not the more progressive conditions. But I do think one takeaway from the materials and that resource I put in the chat is kind of just encouraging employers to be aware of the condition and to take an individualized approach where possible. But again, ultimately, an individual's clinician is going to be able to help them manage the pain and work disabilities the best.
As participants are thinking about any final questions you might have for our panelists, Serena, would you mind to scroll forward one? So here is our post-webinar evaluation. We would appreciate any and all feedback you all have about today's webinar. We also have questions about what you might like to see in the future as we continue our series. Reminder that for folks who are looking for CE or CM credit, please fill this out within the next 2 weeks and make sure to include your name so that we'll be able to follow up with you to give that certificate to you all. Let's see, and we have another question come in. Are you familiar with any effective OA worker training programs?
Specific for the workforce, I'm assuming, OA worker training programs. Katie, are you familiar with anything?
I'm not. No, we'll have to do a little investigation.
Yeah.
I guess one follow-up question to the person who asked that is, are you thinking of kind of an online training, like a module that could be put into a packet of employer training modules, or are you thinking that the worker training would be more for how to manage OA on the job. Maybe a little clarification on what you're looking for would help us.
And Chip, if you would like to speak, I should be able to unmute you if you raise your hand.
I'll just add that all of our resources that we shared with you today are the employer and employee resources that I went through. All of those are freely available on our website. You can download them. The videos are on YouTube, all free of charge. You're welcome to use them. If you're interested in presentations or things like that, we can also work with you on that. We have worked with various entities to customize some of these resources with their branding, co-branding, and that kind of thing. So if that's of interest to you, you can let us know.
All right, let's see. Chip, the floor is yours to
Oh,
clarify.
am I unmuted?
Yes, there you are. Yeah.
Yeah, I mean, I kind of love this challenge because thinking about hybrid approaches to training where, you know, classroom, hands-on, and virtual together was what I was thinking about. And, you know, I love the idea that we would think about a primary or secondary prevention program that could be make a difference in terms of prevention of these conditions. Anyway, the fact that maybe it doesn't exist is a challenge to maybe take it on as an area to work in. So thank you guys. Appreciate it.
Well,
I've learned a lot.
And that's a good point because many of the interventions that we described, whether they're arthritis specific or they're a lot of chronic disease management programs, are for people who already have the condition. But I will also say that many of those are going to be beneficial for people who don't have a chronic disease already. There's just a lot of healthy behaviors and education about chronic diseases that would be beneficial for people who don't even have them. So the programs on our arthritis appropriate evidence-based interventions, while some of them are going to have content geared toward people who already have arthritis or another chronic condition, many of it is much of that education is going to be beneficial for people who don't already have a condition.
Exactly. Yeah. Having been a young person and now being an old person, I can really understand why it's important to start early in life to deal with some of these chronic conditions. And we've also been thinking along the lines, you know, having NIOSH and NIEHS and ATSTR all being lumped into AHA. You know, I think we're unfortunately trying to think about how to actually build an agenda around chronic disease prevention in the workplace. And you know, I feel like a lot of the work you all have done, and also the Total Healthy Work initiative, might become really relevant as we think about how to continue a lot of the programs that we know are being slashed and destroyed and, you know, eviscerated. But we probably need to come up with a way to keep what we're doing alive. And even if we use different language to describe it, you know, we all know as public health people how important that is. So thank you.
Mm-hmm. Mm-hmm.
Yep.
Yeah.
I'll call my congressman. Okay. Okay, Maya. I'll be
Mention
quiet.
arthritis when you call.
Yes,
Yeah,
please.
exactly. I'm in pain.
Great. Mm-hmm. Yeah, Karen, great point. Absolutely.
Yeah, we have a comment in the chat, which I think not everyone can see. Occupational health nurses are on site and are very instrumental in teaching employees and implementing healthy programs.
That's
Mhm.
right. And when we develop these resources that I was sharing earlier, we do have a whole section for healthcare providers and as well as the ones that I mentioned that are more kind of employer focused. And we did have a representative on our advisory panel as we were developing the resources and they were providing feedback on them, was very instrumental in including occupational health. And it's a really important avenue for getting these resources and programs out to employees.
That reminds me as well. Something that we do at our organization is not only try to encourage employers to implement these programs at the work site themselves, but some smaller employers or other organizations that we partner with, if that's not feasible for them, we also invite them to make referrals to our programs. Or even just share information for employees to make self-referrals. So in thinking about occupational health nurses, I was just thinking that it's also helpful sometimes to engage providers to make those referrals to the programs, even if work sites can't necessarily implement programs themselves.
I think we have answered all of the questions in the chat and in the Q&A. Thank you all for joining us. Thank you to our panelists for joining us today. Really enjoyed learning about this topic and look forward to seeing folks in future webinars.